When Justin Timberlake revealed his Lyme disease diagnosis on Instagram, the world took notice. Just after wrapping his Forget Tomorrow World Tour, Timberlake shared that he'd been battling mysterious symptoms, nerve pain, exhaustion, and fatigue throughout his performances. Fans who noticed his low energy now understood the immense challenge he faced on stage. Timberlake admitted he nearly canceled the tour, but the connection with his audience kept him going. His openness sparked a global conversation about Lyme disease, a misunderstood illness affecting hundreds of thousands. Timberlake's story offered validation and hope to others struggling in silence. By using his platform, he's brought much-needed awareness and empathy to Lyme disease. Lyme disease is a serious and sometimes misunderstood illness caused by a spiral-shaped bacterium known as Borrelia burgdorferi. This bacterium is not visible to the naked eye and can only be seen under a microscope, where it appears as a tightly coiled spiral. Scientists have spent decades studying this microorganism to understand how it infects humans and why it can be so difficult to diagnose and treat. The discovery of Borrelia burgdorferi in the 1980s was a breakthrough in understanding the mysterious symptoms that many people were experiencing, especially in certain parts of the United States and Europe. The primary way Lyme disease spreads to humans is through the bite of infected black-legged ticks, also known as deer ticks. These ticks are tiny, often no bigger than a poppy seed, and can be very hard to spot, especially when they are in their immature nymph stage. Ticks live in grassy, brushy, or wooded areas, and they wait on the tips of grasses or leaves, ready to latch onto a passing animal or person. Ticks become infected with Borrelia burgdorferi by feeding on small mammals and birds that carry the bacteria, such as mice and certain types of birds. When an infected tick bites a human or pet, it can transmit the bacteria through its saliva. Pets, especially dogs, can also bring ticks into the home, increasing the risk of human exposure. For Lyme disease to be transmitted, a tick usually needs to be attached to the skin for at least 36 to 48 hours. This is why it's so important to check your body, clothing, and pets for ticks after spending time outdoors, especially in areas where ticks are common. Prompt removal of ticks with fine-tipped tweezers can greatly reduce the risk of infection. Unfortunately, tick bites are often painless and can go unnoticed. Ticks tend to hide in hard-to-see places like the scalp, behind the ears, under the arms, or behind the knees. Many people never realize they've been bitten until symptoms appear days or even weeks later. Once the Borrelia bacteria enter the bloodstream, they can travel throughout the body. The infection may cause a wide range of symptoms, from fever, fatigue, and headache to more serious complications like joint pain, heart palpitations, and neurological problems. In some cases, symptoms can persist for months or even years if not treated promptly. Lyme disease is most commonly found in regions with dense forests, tall grasses, and abundant wildlife. However, as climate change and urban development alter natural habitats, the range of ticks carrying Lyme disease is expanding. This means that people in areas previously considered low risk are now facing increased exposure. Understanding how Lyme disease spreads, recognizing the environments where ticks thrive, and knowing how to protect yourself are all crucial steps in preventing infection. Public health initiatives, community education, and personal vigilance can help reduce the risk of Lyme disease and protect both individuals and communities from its potentially serious effects. Lyme disease cases in the U.S. are rising fast, and the numbers are more alarming than ever before. What was once considered a rare illness, mostly confined to certain regions, is now spreading rapidly across the country, touching the lives of families in both rural and urban communities. The growing concern is evident in households, clinics, and neighborhoods as more people become aware of the risks and realities of this tick-borne disease. In 2023, over 89,000 cases were reported, a staggering 40% jump from the previous year. This sharp increase has caught the attention of health officials and the public alike, sparking urgent conversations about what's driving this surge and how communities can respond. The data paints a clear picture. Lyme disease is no longer a minor threat, but a growing epidemic that demands national attention. But the real story goes far beyond official reports. Experts estimate the true number of Lyme cases is closer to 476,000 each year, more than 5 times the reported figure. This makes Lyme one of the most common vector-borne diseases in the country, affecting hundreds of thousands of Americans annually. Many cases go undiagnosed or unreported, leaving countless individuals struggling with symptoms without clear answers or support. So what's behind this dramatic rise? Climate change is altering the habitats of ticks, allowing them to thrive in new regions and for longer periods each year. At the same time, suburban expansion is bringing more people into close contact with tick habitats, wooded areas, tall grasses, and even their own backyards. As neighborhoods grow and encroach on forests, the risk of tick bites increases, putting more families in harm's way. Today, Lyme disease is no longer just a concern for hikers or outdoor enthusiasts. It's become a mainstream health risk for families everywhere, from bustling suburbs to quiet rural towns. Children playing in parks, pets roaming in yards, and parents enjoying time outdoors, all are now at greater risk of encountering ticks carrying Lyme disease. The statistics represent real people, neighbors, friends, and even celebrities like Justin Timberlake, whose lives have been deeply affected by Lyme. Behind every number is a story of someone facing the challenges of diagnosis, treatment, and recovery. The impact of Lyme can be long-lasting, affecting not just physical health but also mental well-being and family life. Recognizing this surge is the first step toward better prevention and care. Healthcare professionals, researchers, and community leaders are working together to raise awareness, improve early detection, and develop more effective treatments. By understanding the scope of the problem, we can take meaningful action to protect ourselves and our loved ones. Public awareness and education are more important than ever. Schools, community centers, and health organizations are stepping up efforts to inform people about prevention, symptoms, and the importance of seeking medical help if bitten by a tick. Knowledge is a powerful tool in the fight against Lyme disease. Lyme disease is now a national health issue, not just a regional one. As the threat grows, so does the need for a united response, one that prioritizes prevention, research, and support for those affected. The rising tide of Lyme in the U.S. is a call to action for everyone. Lyme disease is tricky because its symptoms mimic many other illnesses. The classic bullseye rash appears in some but not all cases. Early symptoms often feel like the flu, fever, chills, headache, fatigue, and muscle aches. Many dismiss these signs, delaying diagnosis. If untreated, Lyme can cause severe joint pain, facial paralysis, heart issues, and nerve pain, like Timberlake described. Cognitive problems, or brain fog, are also common. Symptoms can come and go, making Lyme a confusing and frustrating illness. Recognizing these warning signs early is key to getting help. Diagnosing Lyme disease is challenging. There's no perfect early test. Standard blood tests look for antibodies, but these can take weeks to appear, leading to false negatives if tested too soon. Early symptoms overlap with many common illnesses, making misdiagnosis common. Without the classic rash, doctors must rely on patient history and risk factors. Even in later stages, Lyme symptoms mimic other chronic conditions, complicating diagnosis. Many patients see multiple doctors before getting answers. This diagnostic maze delays treatment and prolongs suffering. Timberlake's story highlights the need for better awareness and testing. Accurate, timely diagnosis remains a major hurdle in fighting Lyme disease. Early treatment is crucial for Lyme disease. If caught soon, a short course of antibiotics usually leads to full recovery. Delayed treatment allows the bacteria to spread, causing more severe symptoms and complications. Some may develop post-treatment Lyme disease syndrome, lingering pain, fatigue, and cognitive issues. Early, aggressive care reduces the risk of long-term problems. If you have symptoms and live in or visited a tick-prone area, insist on a thorough evaluation. Swift action protects your health and prevents chronic illness. Preventing Lyme disease begins with a few simple but crucial steps to avoid tick bites, especially if you spend time outdoors. Ticks are most active in grassy, brushy, or wooded areas, so being prepared before you head outside is key. Whether you're hiking, gardening, or just playing in the yard, taking precautions can make a big difference in your health and peace of mind. Start by wearing long sleeves and pants whenever you're in areas where ticks might live. Tuck your pants into your socks or boots to create a barrier that makes it harder for ticks to reach your skin. This simple step can help keep ticks from crawling up your legs unnoticed. Opt for light-colored clothing, which makes it much easier to spot any ticks that may have hitched a ride. Dark clothing can hide ticks, so lighter shades give you a better chance to remove them before they bite. Apply insect repellents containing at least 20% DEET or picaridin to all exposed skin. These repellents are proven to deter ticks and should be reapplied as directed, especially if you're sweating or spending extended time outdoors. For extra protection, treat your clothing, shoes, and outdoor gear with permethrin. This insecticide bonds to fabric and remains effective through several washes, providing a long-lasting shield against ticks. After spending time outside, always check yourself, your children, and your pets for ticks. Pay special attention to hidden areas like behind the knees, underarms, around the waist, and in hair. Ticks can be tiny, so look closely and use a mirror for hard-to-see spots. Showering within 2 hours of coming indoors can help wash off ticks before they attach. It's also a great opportunity to do a thorough tick check and reduce your risk of infection. At home, keep your yard tick-safe by mowing the lawn regularly, clearing away brush and leaf litter, and creating a mulch or gravel barrier between your lawn and wooded areas. These steps make your yard less inviting to ticks and the animals that carry them. Place children's play areas and outdoor seating in sunny, open spots away from the edges of your yard, where ticks are more likely to be found. Sunlight and distance from woods help keep these spaces safer for your family. By making these practical habits part of your routine, you can dramatically lower your risk of Lyme disease and enjoy the outdoors with confidence. Prevention is always easier than treatment, so take these steps every time you head outside. A Lyme diagnosis can be daunting, but early treatment with antibiotics is usually effective. Advanced cases may require intravenous antibiotics and specialist care. Some people experience lingering symptoms, post-treatment Lyme disease syndrome, requiring pain management, physical therapy, and cognitive support. Living with Lyme or PTLDS means prioritizing rest, healthy eating, and gentle exercise. Emotional support is vital. Connecting with others facing Lyme can ease isolation. Recovery is often a journey, not a quick fix. Timberlake's openness encourages others to seek help and support. With the right care, many return to fulfilling lives. Justin Timberlake's story is one of resilience and hope. He proved that a Lyme diagnosis doesn't end your dreams, it just changes the journey. Sharing his struggles breaks stigma and builds community for those with invisible illnesses. Advances in research promise better tests and treatments ahead. With support, self-care, and determination, life after Lyme can be rich and meaningful. You are not defined by your diagnosis. There is always hope, and you are never alone.